Hello, it's OFP, looking to discuss over a new topic, that is IIH. What is IIH? IIH means idiopathic intracranial hypertension, also known as pseudotumor cerebri. What's its etiology or its risk factor? In IIH, idiopathic intracranial hypertension, there is a mnemonic called TOD, that means tetracycline, obesity, vitamin A derivatives, and anisole. And other risk factors are women of childbearing age, rapid weight gain like obese, there may be presence of any growth hormone. What's its pathophysiology? Impaired CSF absorption and intracranial venous hypertension. Two things: impaired CSF absorption and intracranial venous hypertension. What's its clinical feature? There may be headache, nausea, vomiting. There may be visual change. Visual change leads to vision loss also. There may be diplopia. Why there is diplopia? Due to sixth cranial nerve pulse. There may be pulsatile tinnitus. There may be retrovalvular pain, neck pain, back pain. How can you do diagnosis? You do fundoscopy, and if you see the papilloedema and enlarged blind blind spot, you may guess that it may be the IIH. You should do MRI, MRV. Why you are doing MRI? To rule out any sort of mass lesion or hydrocephalus. Why you are doing MRV? To rule out any sort of venous thrombosis. In lumbar puncture, you get elevated opening pressure. What's the treatment? How will you treat this case? As obesity is one of the risk factors, we should ask the patient to lose his weight first. If he cannot lose his weight, we can do bariatric surgery. If the patient's BMI is more than 35 kg per meter square, you can ask the patient you can counsel the patient for bariatric surgery. And the drug of choice is carbonic anhydrase inhibitor acetazolamide and topiramate. This is the general, this is the risk factor, pathophysiology, and as a whole, IIH. And how will you evaluate a patient with IIH? If there is a patient with a headache and vision changes, two things: headache and vision changes. Headache and vision changes. And what's clinical assessment? Headache quality. Is it positional? There may be elevated BMI. There may be neurological examination. As there is vision problems, you should do neurological examination because there may be sixth nerve palsy in here. If you suspect increased ICP, intracranial pressure, then you should do visual assessment, visual acuity, visual field, and do fundoscopy. In fundoscopy, first of all, you may find papilloedema, and there may be enlarged blind spot. And after doing fundoscopy, after getting papilloedema, you will look for MRI or MRV. MRI for rule out any sort of mass lesion present or not, and MRV to rule out CVST, central venous sinus thrombosis. If the negative imaging, then you should do lumbar puncture. If there is opening pressure more than 250 millimeter of water and there is no signs of infection, there is no lymphocyte, no PMN, this is likely to have been IIH or pseudotumor cerebri. So diagnosis done, and then you should go for treatment. And this is a very simple topic. All I am trying to mm, discuss, all I'm trying to do is to things, make this thing in a presentable way or palatable way. Hope you enjoy.